All right. I'm Andrea. I'm a community coordinator here at Mercy Volunteer Corps. This is our second of our three-part social justice series. Tonight we are talking about social services. We have Bryn here today with us.
Hello.
She served with Mercy Volunteer Corps and is now a social worker serving people experiencing homelessness. So Bryn, I'm going to let you go ahead and introduce yourself. If you could tell us how you came to Mercy Volunteer Corps and then kind of your journey to where you are now.
Sure. So I'm Bryn Jones and I live in Sacramento, California. I work in an emergency room in a hospital here. I guess I was a volunteer in 2010, 2011, and I went to a Mercy University in New Jersey. That's where I'm from, a small university called Georgian Court. And NVC had come there and done a presentation, and I was still unsure what I wanted to do when I graduated, and I thought this would give me a little more time to figure it out. So I signed up and got sent to Sacramento and never left.
That's great. Thank you.
Mm-hmm.
Can you tell us about the kind of work that you're doing right now and maybe some of those injustices or social justice issues that come up and that you see regularly?
Yeah. So in the ER, as a social worker, I see a lot of social injustices and inequities all day, every day. My primary responsibility there is to help people who are having a mental health crisis get into treatment. That is particularly challenging in this area because there are not enough services to meet the need. We have a really large population of homeless folks here in Sacramento. And a lot of them are experiencing mental health issues. Some would say that that's what led to their homelessness. Others say that homelessness causes mental illness. So some of the injustices we experience, a lot of it has to do with insurance. If you have state or what we call in California Medi-Cal, and other parts of the country it's called Medicaid, you often are going to sit in the ER for a lot longer before you get transferred to an inpatient psychiatric hospital than you would if you had private insurance. And this is, that's really across the board for anything I do in the hospital. It's definitely the biggest, I would say, like social injustice that I see on a daily basis. This is true for getting people into skilled nursing facilities. If you are elderly and need to be sent to a nursing home, your insurance is really going to determine where that nursing home is located, what kind of services you're going to receive there, and things of that nature. I would say that that's probably the biggest one I see on a regular basis.
How has the COVID-19 pandemic affected that part of your work?
It's impacted my work significantly. It's hard to put into words kind of what's the transition that's taken place over the last couple, months. One thing is people aren't coming to the ER. They're terrified to come to the ER because they're fearful they're going to contract the virus while there. So a lot of people aren't receiving the help they need. Other ways, it's really difficult to have a conversation with someone who's experiencing a mental health crisis from 6 feet away. It's really hard to show empathy when you have a mask covering your whole face. I really have always made a big effort to treat everyone like a human being. And it's really important to me for them to feel that. And it's incredibly difficult to demonstrate that with things covering my face and standing far apart, and sometimes even through an iPad. Other things that have happened as a result, Our hospital census is really low as well, so I'm not able to work as much. They've had to reduce my hours. A lot of people have had to take pay cuts, and even our leadership team has taken significant pay cuts because, you know, people just aren't coming to the ER unless they're incredibly ill. And I would say that's probably been the most challenging, is like seeing people die makes me very emotional. It's been really tough. I had to step away from the period. I had to take a leave of absence. I just returned about 2 weeks ago because, you know, I so often preach that mental health is really important, and, you know, this is what I talk to my clients and patients about, and it was time to take my own advice, and I took a break. I had to step away because you can only see so many people intubated in one day without it like really getting to you. And we've seen some young folks, and that's really hard to process all that.
So in addition to like needing to take that break and advocate for your own needs, what kind of things do you do to help keep your spirits high and feel like you're making an impact when the work can be so challenging?
Yeah, well, I have a 2-year-old daughter, and she brings so much love and light into my life that it is hard to look at her face and be sad. So that is really helpful and keeps me busy. I don't, you know, I'm one of the lucky ones. This quarantine hasn't impacted me as significantly as it has others. My life really hasn't changed. I go to work, I stay with my baby, I go to the grocery store still. So those are things that have helped keep my spirits high. Also, you know, just self-care, doing yoga, face masks, whatever it is, journaling, and chatting with my friends and family about everything has helped. And therapy. That too.
How did your experience with MVC add to or impact your professional skills as well as your passion for social justice?
Let's see. MVC changed my life. It's the reason I live in Sacramento. It's why I'm a social worker today. I'm really grateful to the folks at MVC. I had an incredible experience. I fell in love with Sacramento. I worked at a place called Clean and Sober. It was an organization that was on this, basically it's like an entire campus of homeless services. We served about like 800 folks a day at this facility. They had tons of other services there, like daily meals, a women's center where they could get showers, and a day center. Legal services, everything you could really think of. And I learned so much there. I had grown up in a pretty small town, just 1 square mile right on the Jersey Shore, and I just hadn't been exposed to life or diversity or anything. And then I got to move to this really cool city, and it changed my view of everything. And then I went to Sacramento State University for my master's in social work with my MVC roommate, who still lives here. And we're best friends. We actually married husbands that went to high school together, all because of MVC. So yeah, it's really shaped my life in a lot of ways, and catapulted me into this social justice area.
What can all of us do to be advocates for social justice?
I think the most important thing is to speak up when you see something wrong. I think a lot of times we kind of turn a blind eye to things, and we're fearful of the repercussions. But a lot of people in our positions are, we have the ability to say something, and we should. Things that I have found really helpful that are easy to do that make big changes is like calling your local your local like your legislature, your Congress, calling your local representatives, letting them know what you're seeing in your city and the changes that you want to make, showing up at city council meetings. I mean, those things can really make big changes in the area in which you live.
Absolutely. If you could give advice to someone looking into volunteering or working in social services, what would you tell them?
I think I would say that Mercy Volunteer Corps, I mean, it's one of the best things that ever happened to me, and I would encourage anyone to give it a shot. I mean, being put in a situation with someone that you don't, or not just someone, but maybe numerous people that you don't know that are from different parts of this country, and just getting to experience life out on your own in a new city to explore. Yeah, there's nothing really better than that. It's an excellent opportunity that people should take advantage of. As far as like going into social services, you know, I like to be transparent and candid about that career. It's really hard. It's not an easy career. It drains you, and you are not compensated fairly for your work. They work you to bones in those fields, and you're not paid fairly for the education that you have or the work that you do. So I would want someone going into the field to just be aware of that is true.
What advice would you give to current volunteers who are transitioning or coming up on their transition out of
Well, in normal times, I think I would say that, you know, this was one of the best times of my life when I was coming out of, you know, those few weeks transitioning out. And we got to go to Philadelphia for our end retreat, and it was just an incredible experience. And I remember at that time, my roommate and I, we were kind of arguing, and it was tough, but that retreat, it brought us back together. So if you're going through a rough time, hang in there, and just try to make the best of it. For people currently going through, I have no advice. This is such unprecedented times. I mean, I don't even, are people still at their sites? Were they sent home?
Yeah, we kind of have a mix right now.
Okay.
There are a lot of communities, like we have Pittsburgh on tonight, who are all still
there.
servicing.
Wow.
Yeah, and then there are some that are, you know, teleworking or working from their homes with their families. So there's a mix.
Yeah, I mean, that is a challenge, and hopefully they still get to experience some type of end of this celebration or transition, because that closure is really helpful.
Yeah, we will be doing an online transition retreat, but not quite the same as getting to be with everyone.
No, it's not. It's not.
Yeah.
Yeah.
Well, thank you so much for sharing. I'm going to open up the floor to anyone else if you have questions for Bryn or thoughts and reflections from what she shared.
Bryn, hi. It's
hi.
Danielle.
Oh, Danielle, hi.
Hi. We were in the same year together, and we're both also from New Jersey, and we both stayed in the same places where we volunteered. So I wanted to ask you, what is now, guess what, 10 years later, what is the one thing or what are the couple of things that still stick with you a whole decade later?
So much. The one that sticks with me every single day is when I'm unloading my dishwasher. I think of my roommate yelling at me that I didn't let the dishes dry properly and that I was going to get mold on my dishes. So I, since that day, have always made sure that my dishes are very dry before I put them back in the cabinet. Yeah, but there's so many things that stick with me. I mean, so much of what I learned throughout that year working with homeless folks and getting a better understanding of addiction and substance use, that stuff sticks with me now. I bring that, what I know now is because of that job, because of the people that I met there. Yeah, and it was really helpful because I learned so much about the resources in Sacramento through that job that, you know, like a lot of my colleagues will come to me when they have questions about homelessness, because they know that I have like a resource finder in my brain from working at Loaves and Fishes.
Bren, this is Rick. I don't know if you can hear me or not.
I can.
Okay, I have a question for you. How do you feel volunteering as an older volunteer? How would an older volunteer fit into the Mercy volunteer system? I come from a diversified social work background,
Okay.
including the Peace Corps, including AmeriCorps, you know, and I'm still in a position that I want to do more and give more. But I'm a little concerned about, you know, the age difference.
Yeah, I mean, there were some, like, I guess I don't know, non-traditional volunteers my year, maybe. And I think overall they did great. I mean, of course, you go into it knowing like you're likely going to be with younger folks. You're going to be living in a home with younger folks, right? So if you're, you know, if you think you're going to be okay with that lifestyle, I think it was great. I mean, I definitely think someone in the role that I was in when I was a volunteer, you could have been any age to do that role. Yeah, I thought it was a fantastic experience, and it didn't really matter what age you are coming into it.
Okay, thank you.
Yeah, no problem. You have a hand raising.
Hi.
Oh, there you go. Go
Hi,
ahead.
Hi, I'm Susan. I am a current volunteer right now, and I'm an older volunteer, if I could answer that.
Yeah, you're probably the better person.
So, and I would just say my experience has been absolutely phenomenal. And I knew coming in, there were two of us that were older this year of the 36, and I would say, and the rest were all under 30. And the other two of us were much older, much older. And I just can't tell you that the support and they met my needs at my age, and I watched them meet needs at everybody else's age. I didn't ever feel like there was discrepancy, not with my community and not with the other volunteers or my sites. So.
Okay, thank you for that.
Mm-hmm.
Yeah, thanks for chiming in, Susan.
Yeah.
Bryn, I have another question for you. What for a lot of people, before they go to Mercy Volunteer Corps, kind of like yourself, they hadn't really been someplace else really before. They hadn't really traveled all that much, and now that you have like basically permanently relocated to California, what advice would you give to people who are like looking to take that leap and are kind of scared being that distant away from home?
I would say take the adventure. It's an opportunity that you'll likely never get again. This is your chance. And I mean, travel right now is a challenge, but typically you're able to still go visit with your family. You can talk to them as often as you want, FaceTime. Yeah, I think I was able to get back home like 3 or 4 times during my year. So, and I went all the way across the country. Yeah, I think it's an experience you won't regret, and you'll never forget it. I loved it so much. I encouraged my sister to do it, and she was a volunteer too, and she actually was out in Detroit for a year. And then after her year ended, she came to Sacramento and lived with me. And now she still lives in Sacramento.
Hey, Brandon, my name is Ronnie. I volunteered on the Navajo Nation from 2017 to 2018 at St. Michael's Special Education. And one of the questions that I wanted to ask you are, what are some key things you were able to take away from your year that you think that you would have never been able to get if you didn't do that year of service?
Yeah. I think living simply in a community has definitely shaped who I am today. Simple things like, to this day, I still don't have cable. We have Netflix and that's it. To learning how to get along with people that are different than you, and learning how to handle arguments appropriately. One thing I learned through MVC was that, when you have a challenge with someone that you're living with, you need to talk to them about it. You cannot just let it all kind of build up and then blow up on the person, which is like kind of what we did in my family. So it taught me a lot in that sense. And then of course, like education wise, learning so much about homelessness and mental illness and substance use, that type of information was really useful, and just building good relationships with people in this community. And
So, Brent, I have one last question for you.
sure, go ahead.
You talked about, like, in the work that you're doing, the lack of humanity and this being taken away due to the mask and the gloves. And I wanted to know, what are some ways that you're trying to incorporate that, with all the different restrictions and things happening?
It's incredibly challenging. It's really hard to have like a difficult conversation with a patient and they can't like see you smile or be sad with them. Your eyes just don't tell it the way your mouth does. Yeah, and these patients, some of them are in such vulnerable situations. I honestly don't really know how to answer that, because it's definitely the hardest thing I've ever had to experience at work. I would say that there have been some silver linings in this. One is that Sacramento, for the first time in the 10 years that I've lived here, has opened up emergency shelters for people. So I'm actually able to get homeless people into shelters. That makes me feel really good. I mean, not only shelters, they have motels that they've secured throughout the whole city. So knowing that they have a safe place to get some rest and keep themselves, safe, that is very comforting to me. Yeah. I hope that answers your question. I'm sorry.
I have a quick question. So my name's Amanda, and I'm currently serving in Pittsburgh with the homeless population here. And I was just kind of wondering, I'll be transitioning to working in a hospital after this. I'm a nurse.
Okay.
One thing that I have really enjoyed about my year is kind of getting to build some like long-term relationships with clients and really getting to know them. And I'm just like very nervous to just maybe have like a one shift encounter, or, just you only know somebody for a few hours and you don't really get to learn kind of their whole story. I just wondered if you had that experience and how you kind of coped with it after maybe having some longer term relationships with clients.
Yeah. Well, at least for us, we see a lot of the same people over and over again. So there are certain folks that you will still get to know really well and build long-term relationships with. I think for me, when I was going into, or when I found out that I would be the ER social worker, I was actually pretty excited, because prior to that, I was feeling a little burnt out on kind of like the long-term relationship therapy thing. I was looking forward to doing more crisis intervention work. and just kind of meeting people where they're at and getting them linked, and then, you know, hoping that they didn't fall through the cracks somehow. Yeah, so I would say that that was actually something that I looked forward to in my role. Yeah, and I mean, I don't know what do you know what unit you would be on?
I'm just gonna be on like a med-surg unit.
Med-surg, okay.
You know, it
Well,
might
if
be
your
that
hospital's similar to ours,
Mhm.
med-surg gets what a lot of what other people in the hospital refer to as like patient dumps. And those are often, people will say like frequent flyers. I like to use the term frequent friends. Yeah, so my guess is you'll have a lot of frequent friends on that floor that you will get to know really well. And your experience at Mercy Volunteer with working with homeless is going to help you so much in the hospital. I can't tell you the nurses that there are a handful of nurses that have social work backgrounds, and they are phenomenal nurses. And yeah, to be able to support people like in their health, their bodies, and then also have this knowledge of the mind is, yeah, you can't get any better than that.
Thank you.
Mm-hmm.
Are there any other questions for Bryn? I don't want to cut you all off like I did at the last one. Okay. Well, thank you so much, Bryn, for this and
yeah, thanks for
sharing
having
your
me.
part with us and your experience. This has been wonderful. We will be posting this up on our website. And then I will send you all the links. So if you want to refer back to it, send it to friends, you will have that.
Okay, thank you all. And good luck to everyone transitioning out or considering.
Yeah. Thank you so much, Bryn.
Yeah,
Thank
take
you.
care.
For joining.
Thank you. Take care.